Hi, my name is Heidi. I'm a level 1 nursing student. My clinical instructor has assigned me to observe you today.
Excellent. Feel free to ask any questions you might have.
Awesome. Do you have time to give me a report about patient in room 529?
I sure do, Heidi. I'll give it to you in the typical S-bar fashion.
Awesome.
They're probably teaching you that in school right now. Well, the patient went to his doctor, his primary physician, for a non-healing sacral ulcer. It was a stage 3 full thickness. It's 4 centimeters in diameter and about 1 centimeter deep. She is 5'5", 175 pounds. She's ANO times 3, cooperative but anxious. Her eyes are perla, 2 millimeters. She's able to move all extremities. She has pain on a scale of 1 to 10. She's a 6. The quality of pain is sharp, and lung sounds are slightly diminished but clear. She has a slight cough, but it's not productive. The pulse is 88 beats per minute. S1 and S2 are normal rhythm with no murmur or gallops. MPO diet for right now. And she has an IV in the right hand. The doctor has ordered for the wound to be cleared with, normal saline and dressed with hydrocolloid dressing. She's scheduled for surgery tomorrow for the incision and drainage. So, and she also has a few medications ordered in a little bit, the gentamicin, which is an antibiotic, and then also some pain medication, but her pain right now, we just gave some, so she won't need that for a little while.
Okay, awesome. Do you mind if I ask you a few more questions?
Sure, go ahead.
What specifically is this client receiving the gentamicin for?
Well, the gentamicin is it's an antibiotic. It's for her sacrum ulcer infection.
So when should you question administering this medication? And does this medication have any therapeutic serum levels?
Well, you should question administering it if the patient has a hypersensitivity to it. And the therapeutic serum level is usually based on the body weight, the BMI.
What vital signs or physiological parameters would you want to monitor?
Well, you'd want to monitor swelling, the blood pressure, urine output, level of consciousness, erythema, respirations, nausea, vomiting.
Okay. What interventions will be taught to the client for home when taking this medication?
It's really important that they know to take the full dose of antibiotics. A lot of people stop taking it after they feel better. They don't realize that the antibiotic needs to be used for the full term, because otherwise it could make the bacterial virus be resistant to the antibiotic.
Okay. So what in the hospital setting would you want to make sure that this medication was administered safely?
Well, it's important to teach the patient signs and symptoms of any adverse reactions, and to let him know how important it is to alert nursing staff when he does feel those.
Okay. So how will you know if this medication is effective?
Well, you'll see the redness and swelling in the wound start to go away. That's the signs of the infection. And also we can do a blood test to see how many white blood cells. If they decrease, we'll know that the medication is working.
Okay.
Do you have any more questions for me before I go in and administer the patient their medication?
Nope, I think that's it.
Great.
Thank you so much.
Not a problem at all. Heidi, it's so important to know your patient and the medication that you're administering to keep your patient safe.
I completely agree, Karis.
Wonderful. Hi, Mrs. Young. My name is Karis. I'm going to be your nurse today. This is Heidi. She's a level 2 nursing student. She's going to be watching me demonstrate a medication administration, if that's all right with you. Wonderful. So we're going to be giving you some antibiotics today. It's called gentamicin. We had spoken about it earlier. You said you were familiar with it. I just wanted to go over, maybe you could tell me what you know about the medication. Okay, all of that is absolutely true. And I'm going to just ask you to verify your name and your date of birth. Okay, that's correct. So when we... Yep, make sure that you're in the right patient's chart. You know, we just asked her to verify her name and her date of birth. So, and then the second thing that you would check is just that that medication, which we're administering the gentamicin, that it's the right medication. And if you compare it over here, it says gentamicin in the correct dosage. And so we've already checked the expiration date is 7/2017. And basically what this is the right medication rates. It's the right route, right time, right documentation, the right patient, the right order, the right amount. It's just a safety check to make sure that you do everything right. You know, it's important to prevent these errors from happening. So first thing I'm going to do is check on
where I'm attaching influence line
this right here.
and we're going to be attaching above the pump so that it is going through the pump.
Wash my hands.
Same way.
So now what we want to do is scan the patient's badge. It's going to bring them up in the computer so that the computer can double check for us that we are in fact giving the right medication at the right time.
Going to set my
Okay, so when you have the proper one, it's going to come up on the screen so you know that it's correct. But you know, you always want to double check because sometimes the computers may make an error. Okay, before you administer any medication, you want to ask the patient if they have allergies, because although we checked it in the chart, it's always best to double check. So, Mrs. Yan, do you have any allergies? No? Okay, great. And so now you have this here, and because we already have this normal saline running, we're just going to hook it onto it, and that's what they call the piggyback. It's really important that you scrub the hub that you're going to be administering it in, because you don't want bacteria to get in. That would make an infection even worse if that happens. So it's important to take the time to do it properly.
choose.
So we've already, we've primed this line to make sure that all the air bubbles are out. And now that it's inserted, we're going to go over here. We're going to hit channel select. And then because it's not primary, we're going to hit the secondary. Then we're just going to set it up for, it's programmed in there for this kind of medication because it's already a standard dose of the 4 milligrams. So it's going to be in there. Yep, there it is. And so we click on that. But then, again, double check with it and make sure that what it's saying, because it comes up here and it shows you how many it's going to do, but you just want to make sure that it's telling you the right thing. So, and that is correct. We hit select. And then we hit start. Before we walk out of the room, we just want to make sure that we have the 2 drops at least go through. And then, before we administered it, we already checked to make sure that there's no swelling or redness at the IV site, and that the one that's here, that's infusing already, is flowing just fine, so there's no infiltration, there's no edema around the skin. And so this is already set up really nice. It's already gone for the 2 drugs, so we verified that. And then it's important to just let the patient know that if she feels anything out of the ordinary, to let us know. So Miss Liam, you have your call button right here, and make sure that you let us know if you feel any kind of itchiness, or if you feel like you're having difficulty breathing, or if you start to feel hot all over, any kind of symptom at all, just push your button and we'll come in and check on you. Okay? We're gonna be back in about 15 minutes either way. Okay? Do you need anything else? Okay, great.
Thank you so much for showing me that administration of the gentamicin. I just have a couple more questions if you don't mind.
Sure.
Was there any pertinent pieces of information that you reviewed before administering the medication?
Well, I wanted to make sure that the patient didn't have any allergies or hypersensitivity to the medication, which we checked and they didn't. And I made sure to double check that with the patient because although it didn't say it in the chart, sometimes it's important. It's always important to double check with the patient. You know, like I told you when we were administering the medication. But the other thing is you always want to make sure that you check your vital signs, and you want to make sure that you double check the order before administering. Make sure that that you have the proper time that you're administering it.
Okay. And did the information that you verified, did it have an effect on how, like, the administration route?
No, I administered it how it was ordered because there was nothing that contraindicated.
Okay, great. Thank you so much for answering all my questions. I feel like I really learned a lot.
Not a problem at all. I'm always here for you if you have any questions or if you need anything. I'm going to go document everything that I did in the patient's room and also the medication administration and the teaching. Would you like to watch me do that?
Yeah, that would be great. Thank
Okay,
you.
Sure. Well, come with me.
Okay.